Okay, hello everyone. Good afternoon. I don't know where you are. Good evening, or maybe say hello to where based on wherever you are connecting. This webinar. I'm really happy that received feedback on the webinar we hold last Thursday, and happy that you liked the webinar, and hope find this one useful as well. For today, this is the agenda I'm showing you after the introduction. To add some Iranian spice to the webinar, I asked my colleague and friend Mohsen to talk about the project, the split management project. We have started, better to say, or from 2 years ago, and still in progress, and talk about the challenges we faced from the start until the current stage. After that, I will ask the legendary road safety professional, Professor Fred Wegman from TU Delft, to talk about putting a road safety plan into effect. Then we will have a presentation from Dan Kamsel from Agilysys UK about creating an enabling culture regarding the agenda and the topic we are talking about that. And then Patrick from Global Alliance of Road Safety NGOs will talk about the role of NGOs in the implementation of National Road Safety Strategy. And then we will have Q&A session with panelists. Okay, I'm now stop sharing and ask my colleague Mohsen to first introduce himself and start his presentation. Mohsen, floor is yours. Mohsen, you are muted. Mohsen, can you hear me, Mohsen? Let me ask him to unmute. Mohsen, can you hear me? Okay, maybe better to give him a couple of minutes to solve the problem and ask Professor Wegman to start his presentation. So I'm really happy to have Fred with us, Professor Wegman. I think no need for introduction. You know him very well, and I was very happy to learn from him during the Delft Road Safety course in 2015 at TU Delft. Okay, it seems that Mohsen is now ready. Mohsen, can you hear me?
Yes, you can hear me,
okay.
Right?
Yes. Okay, so
and you see my presentation, right?
Yeah, just make it full screen and you can start. Okay, thank you.
Okay, thank you very much, Ali. Hello, everyone. My name is Mohsen, and I'm working in Iran. During the project we've had in our activities, I have been working on a speed management project in Iran. The project has been supported by the Ministry of Roads here in Iran. We have also the support from the WHO country office here. During this presentation, I'm going to actually give some lessons we've learned in this project. And this should be very interesting for the audiences, because this is a project coming from the context of the developing a country which is a developing country. So every speed management project starts with the fact that speed is a major risk factor, meaning that a 5% cut in average speed will result in about 20% reduction in fatal crashes, and something like 12% in serious injury crashes. So speed is very important, and managing the speed is also very important. And the speed management project is a safe system approach project. I mean, it is a project which could be categorized in a safe system approach, where human is in the core of the the system, and we admit that human makes mistake. Humans have physical and cognitive limitations, and all parts of the system need to be well integrated together, so that if one part fails to operate properly, then the other parts do their own operation. So a set of complementary interaction are put into place to create safer roads, safer vehicles, safer speeds, and safer behaviors by the road users. Okay, so speed management actually encompasses a range of integrated measures that together bring road users to a safe system, to a safer speed, and consequently reduce the number of road traffic crashes and the serious injury and deaths that can result from them. So in a speed management project, we have very different stakeholders with very different priorities. And the safety priority is, often confronting with mobility priorities. And as the first lesson, we had in our project different priorities that we're confronting together. And we actually put some time to convince the stakeholders for whose main priority was mobility, to convince them that road safety is very important, to let them recognize that they should consider that speed is and road safety is in the core, and in evaluating the system, they should regard this safety before every other priority. So this was the first lesson we learned. And actually it was very challenging for some of our stakeholders that we were to manage the speeds, meaning that we were to decrease some speed limits to the amounts that were tolerated or could be tolerated by the human body. They were nagging all the time that these speed limits are very low, and there were some requests from us that, to localize the plan, for example, to decrease, to not decrease the amount of speed limits, beyond that was, that was, accepted by the road users, and we were always rejecting these requests because it was a matter of tolerance of human body in a road crash. So it was the same with the lesson one. Different stakeholders often had different priorities. So in our speed management project, we had some parts. And our team actually was working for enforcing the speed limits. Before that, we had some, or the other, colleagues were working to establish speed limits appropriate to the function of the roads, and we were to, enforce the speed limits, and we actually designed some sorts of activities for effectively and efficiently enforcing speed limits. So when it comes to speed enforcement, it is a chain actually from the deployment of the speed enforcement location to the punishment of the violations. So we should not be limited actually to the to specific locations, but we should, extend the whole chain to prosecution and to punishment. And as a second lesson, the whole chain was not actually related to the same organization. I mean, we had some different stakeholders, and the whole chain was in hands of different stakeholders. Even in traffic police, we had different parts. We had different offices, each of which were in charge of different activities, and those parts were not very well related and integrated together, although they were all traffic policemen. So we had, some good activities and designs what's related to speed cameras and the staff. I mean, man held, for example, speed cameras and patrols. So in this presentation, I'm just limited to the designs and activities we made related to the speed cameras. So in our road network, we have a good number of speed cameras. We have now some. We have now 1,700 speed cameras scattered alongside the the road network in Iran. And in our project, actually, we had 3 provinces. For each of the provinces, we had 2 corridors, and the speed management project was actually to be conducted on a network of some 2,000 like these kilometers. So we had a good number of cameras, but there was a big question that how effective was the cameras operating in the network. And this was a question that we went through it by providing some good evidence. And in parentheses, as another lesson, we were in the lack of efficient, in the lack of good data, good road safety data, and good
recording in progress.
Speed and good operating data. So it was very hard actually to collect data, although there were some sorts of data available, but finding them and working with them was really hard, because each part of data was related to a stakeholder that were working on their own silos. So here I'm just giving some evidence when we made some analysis on the speed camera data. For example, this slide, we have 2 cameras, camera A and camera B, and we collected the percent of violations collected in different months, consecutive months, from December 2021 to February 2022. This data is related to a road segment with a speed limit of 110. So if if you assume that the speed limit was 100 kilometers per hour, then percent of violation, for example, for camera off for December 2021 was 21.6%. And if the speed limit was set to 110, the percent of violation dropped to only 3.1%. And if the speed limit was set to 120, the percent violation dropped considerably to 0.6%. So this means that people actually know that. Just let me explain it. Another thing was that the speed tolerance for enforcing speed limit was 10 kilometer and is 10 kilometer per hour set up for the cameras. This means that, or the table simply tells that the threshold of the speed threshold set up on the cameras are well known to the people, because in this road segment, the speed limit is 110 kilometers per hour, but almost everybody is regarding to a speed limit of 120, because everybody knows that they will not be caught by traffic police if they are below 10 kilometers per hour above the speed limit. So this table
Mohsen,
shows that
dear Mohsen,
yes, yeah.
Please wrap up in 2 minutes, please.
In 2 minutes, okay, I will. And another lesson was the average speed, the tolerance, the threshold of 10 kilometers per hour threshold is really high and is very well known to almost all drivers. So this should be something that could be corrected. Actually, I have not enough time to go through, the other tables, but just we'll stick to the lessons we've learned, and we realized that the average speed enforcement is really a necessity, because people can easily take care of their speeds when they are at the speed camera locations. But when they're driving along the the spans, we see that the percent of violations is really high. This means that the speed cameras are not very integrated, or this could be more efficient if the speed cameras could be integrated together to collect the speed violations. Yes, and the last two lessons, where I will not have enough time to go through the details, is that the enforcement rate is relatively low, meaning that from the speed violations detected by the Ministry of Transport and transferred to the Traffic Police Office, only a very low percent of the violations are really enforced, and this is very crazy. This is crazy. And the last but not least lesson is that the traffic punishment is also not deterrent in the country. These are, in short, the lessons we've learned during this project. Of course, the lessons related to the pillar of speed enforcement. Thank you for the time you gave for my presentation. Thank you.
Thank you so much, Mohsen, and really useful lessons and knowing that speed management is necessary in our country or city is something, and knowing how to implement it and how to make it effective toward our goals is something else. And you all saw that Mohsen told us some barriers and challenges during the project. Still, we are working on that in Iran. Thank you, Mohsen. So we are going to have the next speaker. As I told you, Professor Fred Wegman from Delft University is with us, and we are very happy that he accepted our invitation. It was supposed to have him for the the first webinar, but I know that it was his birthday on 16th, so I say happy birthday to you, dear Fred, and the floor is yours for your presentation.
Thank you so much, Ali. Yes, it is a matter of priorities, as you know. But thank you very much for your invitation to address the audience today. I see a lot of familiar faces and names, and I really love to see them again. You invited me to talk about bringing a road safety plan into practice implementation. So the implementation, that is the key issue of my presentation today. So we have nice plans, but poor implementation. This is a phenomenon we know from the literature, not only from the literature in road safety, but from other areas as well. And we call that the implementation gap. The implementation gap is the difference between goals and outputs on paper and how they are carried out in practice. This might be the case in road safety as well. And reading the literature, I don't find a lot of literature on that specific topic in journals. So we have to live with anecdotal evidence, and we all have some anecdotal evidence. And as said, such a gap is not unique for road safety. And this resulted in a new branch of research called implementation science. And that's a very familiar name in the medical sector. So in the medical sector, they face the problem that you have the practitioners and there's a lot of knowledge out there. And how do you organize that these practitioners are up to date with the knowledge? And what their conclusion is that this transfer of knowledge to practitioners is not taking place spontaneously. You have to organize this. And that's similarly, for example, when you talk about lawyers. How are lawyers up to date with what's going on in their sector? So they need training for that. We may face a similar problem in road safety. And I listed here a couple of reasons for that. First of all, the problem of transferability of results. We do have a lot of research, not necessarily implemented in low and middle income countries. And how can you transfer the results of knowledge from elsewhere to your own conditions? Secondly, we face a quality gap in intervention. So the implementation is not good enough because there are organizational issues. Practitioners are faced with competing demands. So they are not just dealing with road safety, but also with dealing with climate change or higher capacity of roads or something like that. So there is a kind of a misalignment with other policies. So these are problems we face. And based on that, I would say we have a problem in road safety. I bring you back to the first decade of action. Many, if not all of you, are part of that. There was an ambition and you can see it here, to save 5 million lives in 10 years' time. That was a global plan of action. And what was the result of implementing that plan? And now we face the first problem. There was no result. There was no nice evidence collected in the world and saying, well, this is the result of implementing the global plan. And I cite here a quote from a report I was participating in, and it reads like: the 2018 Global Status Report from WHO, as you know, estimates the current level of about 1.35 million road deaths, indicating that the ambition of stabilizing the trend of global deaths has not been met. Data on injuries are insufficient to measure progress. And then the targeted numbers of annual deaths are not likely to be reached by 2020. So this is the problem, and you cannot read this type of statements in official reports. So we don't have a formal evaluation, and I consider that as a serious drawback, meaning that we don't have an explanation for that we did not reach the targets. But again, you can hear a lot of anecdotal evidence about what we learned and what was positive and what was negative. And what I hear from many people like you is that you face a lack of political will, that you face lack of knowledge to design your policies, and last but not least, that you lack funding for implementation. But again, there's not a nice scientific article describing this properly. So it is my view, and we can discuss that, but it's my view that the implementation gap in road safety has more than one cause. It is not simple one cause, as we do have with road crashes, by the way. There is a lack of political priority, for sure. There is a lack of knowledge and a lack of road safety experts. And there's a lack of funding. And this lack of funding is always really linked to a lack of political will. So if you have the political will, perhaps you can find the funding. And if you don't have the political will, then it's easy to say you cannot have political will because you don't have the funding. But I consider also a lack of professional implementation capacity. So if we talk about training professionals, we always talk about knowledge on road safety, but we don't talk about how to make road safety practitioners better in implementing policies. So you need some sort of skills to influence top-level road safety decision-making, both in the public and the private sector. And you cannot learn that a lot. If you go to universities, you cannot learn that. So you have to learn it yourself, or for example, in our course in Delft, we pay attention to this specific item. And that brings me to the question I can ask you about your own country, your own jurisdiction. And the question perhaps you can address in our conversation later today is: how successful were you in bringing down the road toll? And basically, did you assess the progress? And do you understand your success? And do you understand your failure? And who is accountable on how you did in this decade of action? So these are the three questions everyone has to ask him or herself working in the field of road safety. And I'm interested to learn about your responses, and you can always write me on that. Bring us to the next decade of action, the second one, 2030. And hopefully you know about the global plan. And I recommend you to have a look if you haven't done that already, because I consider that as a very, very appropriate plan describing what could or should be done in the decade of action 21-2030. So this plan has been published last year, and it states it should be used as a blueprint to inform and inspire national and local plans that are tailored to local context, available resources and capacity. And then the last sentence of the report is, this global plan calls on governments and stakeholders to take a new path, one that emphasizes safety as a core value within the safe system and sustainable mobility. We already know what to do, have to do the tools to do it, and we all have a part to play. So let's do it. This is a statement, I find it in the document, and I don't know whether I fully agree on all the components of that, but we can discuss. In this decade of action, we have a target again of 50%, but not only to reduce road deaths, but also injuries. So at least 50%. That is a challenge for road deaths. That's also a very big challenge for injuries. And one of the problems we face here is that we don't measure that properly already. So we have an additional step to make. And this global plan is called a blueprint for national and local road safety plans. And I'm going to talk about that right now. So have a look at this nice infographic produced by the World Health Organization describing the plan in one page. So we have this 50%, we have this safe system approach, and the report pays specific attention to implementation, how to do it. We know what to do, but that's a question for me. Do you know exactly what to do in your or for your jurisdiction in order to arrive at 50% reduction in fatality and injuries? Do you know it really? And do you know how to get it done? I am familiar with quite a couple of countries and their strategies, and the honest answer to this is not really. And this is a matter of road safety management. And that is not new, but nevertheless, we have to answer these two questions in all jurisdictions. I listed these 9 key elements of road safety management in an article I drafted before for effective implementation. So I describe these in this article in more detail, and they are all important. You cannot miss one, and that makes it so complicated to deal with this item. So I'm not going to talk about all these 9 points in more detail, but it's important for you to understand and to take the message from me that you need to pay attention to all these 9 elements in order to make your plans effective in reducing the number of people killed and injured. We can talk about a little bit about road safety leadership, because for me, that is the starting point of everything. If you don't have a strong road safety leadership, it is so complicated to find your way in this. And that means that we need that strong leadership. Where the leadership is coming from in your jurisdiction doesn't matter. It can come from politicians, it can come from professionals or representatives from civil society. So where it comes from, I don't know, but you need that. And this leadership is also needed in organizations, in stakeholder organizations. So for example, the police, and Mosen talked about that already, in the road authority, in municipalities, in Department of Transportation. and now we face the problem that leaders come and go, and that's a problem we face all. So I served 7 ministers in my country, and all the time I had to talk with them about road safety, introduce them in road safety. You have to accept in a democracy that you have new leaders, but for road safety it's not so easy because if you have one leader on board, you perhaps need to talk with his successor again and start the game all over. Sometimes the road safety leadership is transformed in this lead agency. You are familiar with that perhaps. I trust that a lead agency can be very, very strong when it comes to implementation. However, you cannot rely only on this lead agency because you need far more stakeholders to implement policies. But this lead agency can be important for a couple of issues as I wrote down in this slide. So the idea is that you start from the global plan, that based on this global plan, you try to identify key road safety management elements for effective implementation. And these elements are different in each jurisdiction. So you cannot simply come to the Netherlands and say, well, it's working in the Netherlands, and now I simply duplicate that and going to do it like the Dutch. That's not the right attitude and position. So you have to adapt and tailor working concepts to your own condition. And in the sunflower studies, people who read these studies know that is depicted by the structure and the culture. The structure of the organization of your society is different than in other countries, and the culture of decision making is also different. In my view, this tailoring work should be done by local road safety experts. I put a question mark to that, but I'm more and more convinced that road safety experts from the country, knowing the country well, knowing the structure of decision making well, knowing the culture of decision making well, have to do this job when it comes to implementation. I see 2 important steps for positive results, for effective implementation. First of all, you need a strategy and action plans. Drafting these plans is government-led, but you have to understand the concept of shared responsibility. I'm not going to explain that right now, but it's, in my view, government-led, and you have to understand that other stakeholders should be part of that. So you need a strategy and you need action plans. If you don't have that, it's very complicated to make progress. And secondly, you have to create conditions for implementation. Again, in a document I drafted earlier, I prepared a checklist for the quality, check the quality of policy documents. And here I have 8 points. I don't expect you to read them, but it's important that these policy documents are good and that if you implement them, that you have a good chance that you reduce the number of people killed and injured. And the second one is a checklist related to implementation. And here again, 5 points I described here. And these points are really needed to see whether you are making progress in implementation. And what this monitoring of this implementation is key to learn from your own progress and to decide whether or not you're on the right track or not. So the way forward, and this is my last slide, Ali. I see in road safety that we face an implementation gap in many, if not all, jurisdictions. We have that problem. We have to face that. I indicated in my presentation a couple of ideas how to address this implementation gap. And again, the same quote from the global plan, the last sentence of that plan, we already know what to do. Yes, if you describe that for your jurisdiction, we know what to do. We have the tools to do it. I have my doubts, but nevertheless, you can develop them. And we have all to play a role in that. And that is this shared responsibility paradigm that we really need. So let's do it. And that's why I'm very positive, because I trust that many of you are on this way forward to make real progress in improving road safety in your jurisdiction. Thank you so much for your attention.
Thank you very much, dearest Fred in the world. Yeah, another insightful presentation. And whenever I attend where you're presenting, I again view the presentation, watch it, and for me, word by word is precious, and learn from them. And still I'm using the Delft course presentation, because as I learn new things, I found something else that I remember it was something mentioned during the course. So years of experience are behind of each word. So I really recommend participants to view again the recording that it is sent to you, and learn more things that just don't limit yourself to this 15 minutes or 20 minutes. So thank you again for this nice presentation. I want to go to the next speaker. I want to invite Dan Campsall from Agilysys UK. They are doing great work at Agilysys and received Prince Michael Awards for the activities, and other awards. I don't know completely what they have received or they achieved so far, but I'm quite familiar with what they are doing, and they also have some webinars on different road safety issues. I highly recommend to follow their website and newsletter, and enjoy their webinars as well. So thank you so much, Dan, as always, for accepting our invitation and your efforts on road safety and support. And the floor is yours for your presentation. Thank you so much.
Thank you, Ali. That's very kind. And yeah, right at the start, I'd just like to say an enormous congratulations to you and to the team at Road Safety Pioneers for the work that you do in convening events like this, and to see so many countries represented here, all wanting to engage with this material is very encouraging, and fantastic credit to you. Also probably worth saying that there's always, it's an unenviable task getting to follow Professor Fred Wegmann when he's delivered a presentation, because, you know, as Alice said, many of us have sat under his tutelage in different conferences and courses around the globe. So hopefully you'll get a sense of me building on that foundation that Fred has already laid. So hopefully you can see my slides, and what I want to do is just sort of take you from the foundation, as I said, that Fred has laid, and then build on a specific element, which is around some work on culture and the importance of culture in us being able to implement the road safety plans and strategies that we've been talking about. Just to say a very quick word about us as an organization. Agilysys has been around for about 5 years, but actually the senior team have been working together for the last 2 decades. We're very much a sort of mission-led organization. Our goal is to transform lives through safer and healthier communities. That is principally in road safety, and we get to work with national governments, subnational governments, and some global organizations to do some of the research and policy development that helps some of that to happen. So what I want to take you through then is, as I said, I'm going to be very much building on the things that Fred has already said. So he talked about the road safety management system. That will be where we start. And then on top of that, we'll look at some of the things that we can do that help towards that implementation process. And then I want us to take actually a bit of a deep dive into the question of culture. So we talked already about the road safety management system, and Fred outlined his sort of 8 or 10 bullet points or something from a paper that he'd written about what are the core components of the management system. Some of you will be familiar with this diagram. It was used in the 2009 publication by Tony Bliss and Jean Breen in order to highlight how we build the road safety management system in countries, and we build capacity. So the triangle breaks down into these 3 layers. You've got these institutional management functions at the bottom. At the top, you've got this high level of focus on results. Those are outcomes in terms of crashes and injury, but also the measures of social cost associated with that. And in the middle, you've got this tranche which focuses specifically on the road network. Now, actually, when I go back and look at this now, I think there is a huge amount of this model that has stood the test of time. And as you will see from the list of sort of frameworks that it's been built up from, including some of Fred's own work, you know, it's not surprising because there's a great deal of intellectual capacity and creativity that went into the development of this model. But nevertheless, I think, you know, one of the things that we've recognized more recently is that we've got to think beyond the road network, and we've got to think in a much more systemic view. So some of you will be, I imagine many of you will be familiar with the SAFE system as a model. We've already seen one version of this when Mohsen was sharing his slides a little bit earlier on. At the heart of it is this recognition that humans are fragile, that too much kinetic energy in a collision will result in serious injury or indeed fatalities. It also recognizes that humans are frail, that they will make mistakes, and the system needs to be able to accommodate that. It also recognizes that the responsibility needs to be shared between the designers, the managers, operators, and users of the system. But also, we would tend to refer to, or I would tend to refer to sort of, there are then these kind of components of the SAFE system. So safe roads and roadsides, which is what's largely picked up in the Bliss-Breen model, is one element of it, but it needs to be worked in with other components of that system view so that we are working on all of the parts of the system where we might have the opportunity to make it more robust and to implement change, and therefore to deliver a more resilient system that will sustain human fragility and human fallibility. And so we need to work on ensuring that the vehicle fleet is safe through increasing vehicle technology, and making vehicles more resilient in the case of crashes. We need to work on safe road use, so either segregating road users to ensure that they don't come into conflict, or indeed on the ways in which people use the road system. We've talked already today about the need to have safe speeds. So if kinetic energy is really the thing that matters in the event of a crash, by slowing traffic down, then we can make a drastic difference in terms of the injury outcomes within the system. By speeding up our post-crash response, implementing good quality trauma care and good quality rehabilitative services, actually there's a key element there in the post-crash response. And in this model, we have left in the road safety management piece, but because I think there is an operational aspect to that, but then there is also sort of the strategic aspect, which I think is sometimes those things end up being conflated. I think there's an argument for seeing them of seeing both the strategic and operational as independent and interrelated disciplines if we want to ensure a truly safe system. And one of the things that often I think gets missed is we often think about safe system being, you know, safe vehicles, safe roadsides, post-crash response, etc. But in pretty much any of the good quality safe system models that you will see out there, you really do need to attend to what is around the outside, because that's the system view. That's the lens that will enable us to ensure the coordination and interoperation of all parts of the system in a coherent way. And I think, you know, we've done quite a lot in many countries about strengthening the components of the system. I think many countries actually fall down, and I would say that of the UK as well, on the system elements that sit around the outside. So Fred's talked already a lot about leadership and coordination, ensuring that you've got the legislative and regulatory landscape in place. Have you got standards and training in place for road safety engineers as well as for drivers and road users? Are you doing the education and communications work that's necessary? And we've already touched on today the research, monitoring and evaluation and compliance and enforcement. Yeah, those aspects all need to be in view. And also Fred sort of talked a bit about the global plan and, as well. So I'm going to largely gloss over that to get to the stuff around culture. Although I did think it was worth just highlighting some things that have been introduced to the global plan that have often been absent from other particularly global strategies and from many national strategies. So the role of gender and identifying gender disaggregated data and variable risks between men and women in society is something I think we need to consider. The role of technology and that can play in us building out the system. And Fred's already mentioned it anyway, so I don't need to labor it, but the point around capacity development, have we got the capacity to deliver the safe system that we want? So one of the things that I think is a considerable enabler of us being able to deliver that system is targets and performance management. Now, one of the reasons I think it's a significant enabler is not because targets on their own make the difference, but they are an expression of the political will that we have already talked about. When we have got leaders who make commitments about targets and seeking to get towards certain levels or reduced levels of injury, it's an indication that they are committed to that political purpose, and it helps to unlock so many other things that follow on from it. So once we've got targets, often the investment will follow. Once we've got targets, often the coordination between different departments, government departments and ministries will follow. Once we've got the targets, we'll start to see that actually an emphasis on educating in the right areas will follow. So targets, I think, are hugely important as an enabler, but it's because they speak to the political will, the determination behind it. And if we can get political leaders to move towards a place of commitment to targets, actually it can have an effect in unlocking some of the other things that will follow. And there are plenty of, you don't need to invent new targets, although they may need to be localized to your specific country and circumstance. But the WHO created a set of 12 voluntary targets that some countries have been starting to sign up to, and they speak to aspects right across the safe system that you might want to introduce greater resilience in terms of governance, in terms of the road network, in terms of safe road use, in terms of post-collision response. So there are target frameworks out there that exist. And I think one of the other things that we want to see in place alongside the targets then are safety performance indicators. So our target tells us where we are trying to get to, but as was pointed out with the global plan for the decade of action through to 2011, once we got there, when we look back, we saw that actually we hadn't achieved the performance that we were hoping to achieve. And so safety performance indicators help us to monitor our progress on the way towards the goal that we're seeking to achieve. They often indicate behaviors and actions within the system that help us to understand whether actually the system is becoming intrinsically more safe, and we can therefore use them to understand the safety of the system overall. And so I've put a few examples on here. So the proportion of modal share for non-motorized transport and public transport, the decent indicator of whether our multimodal transport and land use planning approach is working. If we're not moving people onto non-motor, away from, you know, individuals in cars, away from motorized transport onto non-motorized transport or onto public transport, then we're not actually going to deliver the safety benefit that those systems can introduce. Something like speed limits, the proportion of vehicles traveling within the speed limit in urban areas. We know that speed is key to delivering the safe system. So therefore we can measure the proportion of vehicles that are sticking to speed limits. That gives us a very good indication of whether safety in the system is heading in the right direction. And that will lead into our outcome data in terms of casualties, etc. But I said I wanted to talk a bit about the importance of culture. And I think this is something that many have started to look at in recent years and gone, we think there's something really important here, but we don't necessarily really understand why or how, or indeed how to change it. There's been some interesting work done in the last couple of years looking at Hofstede's index of national cultural identity. So Geert Hofstede developed a series of variables to understand national cultural identity. It's basically the kind of collective beliefs that seem to dominate within different countries around the globe, and they vary. So you've got things like power distance, which is how a society generates solutions to resolve inequality amongst its members. Have we got societies with very high distance from power to their citizens? You've got things like masculinity versus femininity, which so the cultural tendency towards differentiating emotional roles on the basis of gender. We've got very sort of significantly different roles between men and women, or actually, as we find, say, in the Scandinavian countries, are they much closer? Have countries, do they have a long-term orientation or a short-term orientation? If they're very short-term oriented, they might be willing to indulge in risk behaviors much more readily, whereas if they've got a longer-term orientation, they will think about, you know, sort of safety and policy development over the long term. And there's been some work started in, as I say, in recent years. So Wouter van den Berg from VS Institute in Belgium, who many people will have heard of, led a project with some international collaborators to look at the comparison between the fatality rate and some of those indicators within Hofstede's cultural maturity, national cultural index. And you can see some correlation between some of those points. I think there's still quite a lot of work to do to really understand what is the kind of cultural composition that might lead towards enhanced safety. And I think there's then a whole nother job to do to think about, and how do we help cultures to move towards that? But I wanted to just then talk a little bit about some work that we've done here in the UK to think not just at the national level, because it's quite hard to think, how do we change national culture in order to address an issue as discrete and confined as road safety, because there are very many things that will be influencing that national culture. What we've said is there a way in which we can look at the microcosm of individual organizations, which all have their own culture, and can we influence that culture in order to make those organizations more amenable to safety, and in particular to adoption of the safe system within their practices? So this could be road authorities, it could be large logistics companies, it could be engineering companies, etc. So what we've done is we've looked at defining safe system actions, which are all of this I'll say a little bit more about. We've reviewed cultural maturity models, we've reviewed behavioral change models. And we've looked at ways in which we might embed some of those safe system imperatives and categorize safe system actions. And all of those parts put together is what we've done to create a safe system cultural maturity model. So, as I said, we've looked right across the international literature. We reviewed a whole bunch of the international publications, including the Global Plan for the Decade of Action, the guidelines for conducting road safety management capacity reviews, which we've mentioned, ITF's Zero Road Deaths and Serious Injuries. We've looked at many of these international publications, and we've categorized the actions that they identify, well over 100 safe system actions that come out through all of those. 48 of those come out consistently across many of the publications as being priority actions that needs to be attended to. So we've got a really clear idea of what safe system action looks like, but what does the local culture look like? And so one of the things that we've looked at is cultural maturity models within organizations. This could be, the Ministry of Transport. What's your maturity model look like in relation to safe system road safety? And as we look through much of the literature around that, this is the model. It's Parker and Hudson's model of cultural maturity. You see it kind of goes through 5 stages, from the pathological, which is, what can we get away with, right through to the generative, which is safety is very much how we do things around here. Can we get organizations who think safe system is the way that we do business around here? Well, that requires us, in order to join those dots, we need to think about how we might possibly change behavior. And there's a particular model called the ISM model, the behavior change model, that focuses on the individual, the social, and the material. That when you look at the literature around both cultural maturity and around safe system, works really nicely in terms of identifying what levers we can pull and buttons we can press in order to influence behavior. So we've sought to put all of that together in the development of a safe system cultural maturity model. So at the heart of it, you've got the construction of that culture, whether it's within an organization or whatever, that what are the beliefs, the attitudes, the values that are consistent in that organization and define how the organization runs. But any organization also has a bunch of kind of customs. What are the things that they do? What are familiar practices within that organization? Crucially, any roles that they have. So if you say that you're a safety-oriented business, but you don't have any roles with safety in the job title, you're probably not living up to your own rhetoric. And then around the outside, we've got these operators. They are all classified groups of action within those safe system models. So putting all of that together, we've taken those safe system imperatives, safe system pillars, we've prioritized the safe system actions, and we've identified as many of the change mechanisms as we could within the safe system in order to create a tool for organizations that can help them diagnose where they're currently at, help them transform themselves to become more effective organizations with the safe system, compare their performance against others, and also evaluate over the long term whether they're making progress in that. I'm going to skip over that slide, but just to let you know, we tested that on a wide variety of road safety organizations in the UK, right across England, actually, with quite extensive coverage. And we got them to run through the survey tool that we developed to do that. And what it seems to indicate is that actually you can identify and compare performance within organizations and between organizations to understand how mature they are in terms of some of those key safe system operators that we would want them to be focused on. And also you can do the analysis by safe system components as well. So you can see which are the bits of the safe system that they really need to work on if they are going to increase their maturity and to move towards being an increasingly safe organization. So I've used up my time, but thank you very much for your attention. I'd be happy to take any questions as they arise in the Q&A session. Ali, back to you.
Thank you so much. Thank you so much, Dan. As always, another amazing presentation. During your presentation, I was thinking about sometimes we hear in for example, in our National Road Safety Commission, that during the last decade, we have done all we were able to. But after your presentation and Fred's, we see that we have still a lot to do, and there are many things and many aspects and many activities with more details, and we have a long way ahead, and maybe we should rethink about what we have done and the results that we have reached, and of course based on the principles of safe system approach. It's an ethical approach, so no even wonders is too many, so we have a lot to do. Thank you so much, Dan, and really I like the presentation and harvested, if I'm right, harvested model, and liked it very much. Okay, without any delay, we will go to the last presenter. I want to invite Patrick to the floor from Road Safety Global Alliance for Road Safety NGOs, and he will talk about the role of NGOs in implementing the national road safety strategies. Okay, he's sharing his slides, and thank you for joining us, Patrick, and accepting our invitation, and floor is yours.
All right, thank you very much, Ali. It's quite an honor and pleasure to be here. And I think this invitation was quite in order, and I'm very happy to represent the Global Alliance of NGOs for Road Safety to try and connect the dots from the presenters, and also to give the audience a chance maybe to ask a few questions, follow up on what the presentations are about. Yes, my name is Patrick Nyenjui. I'm the Capacity Building and M&E Manager at the Global Alliance of NGOs for Road Safety. To put things in context, I think I want to start by saying that the Global Alliance is a network organization, and I'm glad to see several of our members in this webinar. So those who know us, those who are members, welcome. Those who are not members, you can later, look at our website at roadsafetynGOs.org. Currently, we have coverage that goes about 300 members, actually 3 or 4. I just checked the updated, and then we are in 104 countries globally. And the main work of the Global Alliance is, it was formed back in 2011, and it is also in response to the first decade of action that Fred talked about. And the role of NGOs was, is quite important, as I shall elaborate a bit later. And so coordinating the work of road safety NGOs who have been doing this work for a long time, because road safety NGOs and generally the civil society at the onset, I would like to say why they are important is because we know they are actually the ears, the eyes, and the voice of the society where they live in. And therefore, the challenges of the communities, the pain, the gains, everything that is happening in the community is actually reflected through the eyes of the civil society. And these are organized bodies that are able to really bring out the issues to the government, to the stakeholders, to the partners, and generally to the global community. Now, the Global Alliance of NGOs for Road Safety works on 3 pillars, which is networking and sharing. This is about information, sharing experiences, meetings, and holding global as well as regional and national meetings. We do a lot of advocacy, driving campaigns, and a lot of capacity building, which is a very important facet of the Global NGO for Road Safety. And why road safety for us is just basically because for the civil society, I think the one cry is that the consequences of road crashes, the death and injuries, the devastation that comes to the families, and all the other ills that we know are as a result of road crashes, the consequences of all these are preventable. Unlike some other public health concerns, consequences are preventable, and we know that it is not right that people are dying on the road, and we know the solution to this. But we have seen from the last decade of action that there has been very, very little sort of change. So I would like to begin by saying that with the new decade of action coming into play, the Global Alliance in its mandate has looked at what is the new role of NGOs. Everybody agrees, all the partners, the stakeholders, we agree that the last decade, although we did not achieve much, not everything was lost, because those 10 years were able to put in place good frameworks, started good conversation, and also brought people together. And you can see it also coincided with the Millennium Development Goals translating to Sustainable Development Goals. So in as much as the last decade looks it was a bit of no hope, but we know some things are in place, and that's why the renegotiation for the second decade of action, where the NGOs were very important in negotiating for the second decade, is a very important period that now, if the frameworks, the people are aware, what do we do now? We need to fast track that to reach that particular target of 50 by 30. So currently, as the Global Alliance, we normally do a lot of work to make sure that our members are able to respond to the challenges that are currently, in the current period, and also that we have the capacity to actually do that. And therefore, currently we did a research with our members, a survey on what they think the new decade is all about, what they think their role is. That coupled with what came out from the new global plan for road safety, 3 key items came out that the role of NGOs would be advocating to drive implementation and financing of evidence-based intervention. Secondly, holding decision makers accountable for the road safety delivery and empowering and communities to demand a safe system. So in that light, therefore, you find that what really are NGOs therefore doing to do that? Just give me a minute. Okay. So in response to the new decade, because we, as the global plan says, is not business as usual, things have to change. We have to fast track things, and we must base a lot on evidence. One thing that NGOs are doing, and they have started doing from the launch of the global plan in October 28 last year, NGOs have been very proactive in making sure that their governments are aware of the new global plan. And they are not only aware, but they were responsible for handing over, whether it is ceremonial, but make sure the government are aware. And I don't know whether this short video will play, just to show.
Might have seen videos like this before, but here's the big secret. Anyone can make one of these videos in a few minutes.
Ali, is my video visible from your end? Ali, can you see my video?
No.
Okay. Okay. Are you able to play from your end? If not, then we can still skip it.
Okay, I can do
Okay.
it after.
Okay, you can play it after. Yeah, let me just continue.
Yeah, better to continue now.
1 second, let me go back again. All right. All right, so I was going to say what are NGOs doing, and this is in line with, as the webinar is saying, we are moving from just talking to action. So the NGOs have handed over the global plan to about 38 countries now, and this means that the governments are aware, and they are also aware that the NGOs have a role, or they can be involved as very meaningful participation of the road safety agenda. And if you look at what the NGOs are really, just 1 second, so after the handover, many countries are continuing to hand over the road safety plan because, you know, for example, in low and medium income countries have a lot of different priorities, but yet we know that the road safety is a problem. So making sure that the government knows about the global plan is an important work of the NGOs, and that's what they are doing and continuously. Apart from that, the NGOs are following up with their governments to share the road safety plans now that are national, making sure that you adopt the global plan to the national strategy for the new decade. So far, in terms of our achievement, 38 countries have been handed over, and NGOs are continuing to do this. The second thing that NGOs are doing right now is challenging the very notion that road safety is a personal responsibility. In as much as the global plan talks about shared responsibility, that we are seeing from the civil society side that we want to bring attention to the government's responsibility in providing safe road transport system that allows people to travel without being killed or seriously injured. This is enshrined in the safe system, and we want to bring out the picture that road safety is not like the jungle where you are told you have to survive, but the government has a role to provide the safe system. Yes, it is a shared responsibility, but the government cannot escape the prime or the important role of making sure that there's a safe system. So we are saying it is the government's role to supply a safe system rather than an individual community members' responsibility to keep ourselves safe. So there has to be that government taking responsibility for the new decade. It cannot be business as usual. Then inspiring and empowering communities, NGOs are bringing the relevant information to inspire and empower communities to demand government to supply a safe system for the people. So the information, for example, what we are getting here from Fred, from Dan, all this information, because government has so many, maybe a lot of on their table, and they may not be aware. So it's the work of the civil society to bring this information to the communities, and the communities to demand a sort of a safe system. Then we also generate and amplify community demand as a way to increase the political incentive to deliver road safety for the people. And this is one area that I think Dan was talking about. You know, the culture. How are we looking at the organizations and the culture? Is it pathological, or is it the way generated that it's a way of life that we are able to adopt safe system? The next thing is that that is so important, that comes out every time about financing and funding and budgets. The NGOs are currently highlighting the decision makers have the power to determine where the funds go and how funds are spent. So since a country is run by the government, the decision makers have that power. So the NGOs are putting pressure on budgets. As governments, we are asking them to report on specifics of government spending on road safety. We need to see a budget that is dedicated not only for infrastructure, but infrastructure designed to save lives and injuries, rather than simply road maintenance to assist purely the travel speed. So building highways like is very common in Africa, highways that are increasing speed, and the notion that speed makes things move faster and makes you arrive faster. All these are sort of questionable anecdotes or questionable ideologies that we need to look at. Now, we are also doing track governments to demonstrate genuine commitments. Governments have been known to make commitments in the last decade that are not backed by action, or they are not backed by financing. So commitments should have finance towards implementation, and implementation of evidence-based interventions. The evidence-based interventions is a word that is coming to be the centerpiece for road safety implementation, because we know what works, and from the discussions that were given by Fred there, we know what works, but we are not doing it. So what is the problem? It is definitely that there's a need for that political will, comes with financing. But also NGOs, we know that community can put pressure on the government. So we want to amplify the public demand for transparent, dedicated, and impactful investment in road safety. So NGOs are also working closely and collaborate with academics, researchers who empirically can identify the effective solutions. And this is what we are talking about, evidence-based interventions. These, as Fred was saying, depending on the jurisdiction and the culture, can be domiciled They don't have to be transferred directly, but depending on the jurisdiction as well as the culture, the evidence-based intervention, if it's speed, it can be adopted according to the jurisdiction.
I ask you to wrap up in
Finalize?
1 minute, yeah, please, because
Yes,
we need
definitely.
some time for Q&A session.
Okay. Finally, actually, this is my final. The challenge that NGOs face and what the Alliance is doing, it is actually in identifying, and according to our member survey, what evidence-based intervention to advocate for. Then the other is low commitment and poor political will, and then not recognizing NGOs and involving NGOs in meaningful participation. And what the Alliance is doing is we are developing what we are calling Alliance endorsement list. And this endorsement list is an updated list that will select very key evidence-based interventions that will be sequentially implemented or advocated for as we move on. And so this evidence endorsement list is actually coming out the end of this year, and we'll be launching it very soon. Secondly is a tool, a framework to track government commitment and implementation. And finally, we are doing a research on what can make NGOs thrive better. It's an ongoing research that will bring about what can the government do and what NGOs can do to work better in a more relationship. So thank you very much. And I know it was very fast, but open for any questions. Thank you, Ali, and thank you, Fred and Dan, for laying the foundation for what I have just outlined. Thank you very much.
Thank you so much, Patrick. Very amazing presentation, and the role of NGOs, how we can help the government, how to make them to step forward or toward their defined goals, and meaningful participation of NGOs. We will have less than 10 minutes for Q&A session, and this time we have 1 or 2 questions so far. If you can raise your hand. So I ask you to unmute yourself and ask your questions from the panelists. I can see Mona Ali. I know her. She is the I think professor at German University of Cairo, Egypt. Please, Mona, ask your question, but short. Unmute yourself and you can ask your question. Yeah, again. Please unmute yourself. Let me just not working. Okay. Just happens, but it seems that there are problems. Okay. She was asking about, as you mentioned, I think it's better to ask Fred to take the question, mainly about the political will. You mentioned there are different stakeholders, she's working in university. What's the role of university when, for example, in a situation that we have no political will, or in general, what's the role of universities and academics?
Yeah, I think universities can play a role. Many professors are trusted persons in society, and they can have an impact on decision makers from the government or from the private sector or from the NGOs. So if they use their knowledge power to influence decision making, that can have an impact on societies. And I endorse all sorts of professors trying to be active in the public debate on road safety. There are not too many, but if there are there and they have an interest, I would say use that power to influence decision making. Medical doctors do have a similar position in my view. Medical trauma doctors, for example, can do a similar thing and try to influence decision making and try to influence the highest level of decision makers, because that's important as well.
Thank you. Thank you. Dan, next is to you from the chat box. Is there any accepted level of risk in road safety? And yeah, there are different layers, and from different aspects we have a definition of risk. But is there any accepted level of risk when we're talking about road safety, crashes, and risk factors?
Sure. So I think the safety system view is that that we deal with those that cause the most severe forms of injury, and some countries have chosen to use things like abbreviated injury scale to identify the point at which they identify severity. So yeah, the goal it would be some sort of utopian ideal to have a transport system where there is zero injury, but what we really need to deal with are those higher order incidents where the severity is at its greatest. I think even just thinking about it sort of intuitively as a parent, I want my children to walk, I want them to cycle, I want them to play outside. I recognize that there is a level of risk associated with them engaging in those activities. Sometimes they will come home with, scraped knees and cuts and bruises. But it's far better for them to be outside exercising, because there are many other problems when we have a very sedentary and immobile population, but it's about identifying a point at which we address those higher order injuries. And I think that's a big challenge for many road safety organizations and leaders. I think within our context, as soon as you say, actually, we're going to do zero harm on our network, you realize the challenge that presents in terms of other policy areas, because you're hitting up against issues of around the use of strategic assets, the efficiency of our road networks for the economy, what we're trying to deliver in terms of improved air quality, what we're trying to deliver in terms of carbon reduction, what we're trying to deliver in terms of educational outcomes or health outcomes. I think there are challenges, and it was probably Fred who spoke about it earlier. We need to recognise that we're seeking to push forward an agenda that interplays with very many other things. But certainly, I think dealing with those higher order crashes, road fatalities, and the most severe of injuries has to be our priority.
Thank you. Again, from Fred. Also, we had the same question in another seminar, talking about
Ali, I just want my microphone wasn't working, but thank you very much for the answer, Professor.
Okay. Thank you, Mona. And the question is about corruption. Some countries talk about, okay, we have standards, we have regulations, we have, I don't know, maybe infrastructure improvement, but mostly in case of enforcement or other relation with government officials, what we can do when we see that the rate of corruption is high and the effectiveness of the activities are reduced?
But this is a far more broader issue than road safety, as a matter of fact. And as we discussed, what is the reasonable level of the number of road crashes or injuries? What is the reasonable level of corruption? There is no reasonable level of corruption. You want to get rid of corruption. And that's interesting now. So, as you know, we have the awful war in the Ukraine right now. As a result, there are steps being made by Ukraine to become a member of the European Union. And it will be enforced by the head of states rather soon, as a matter of fact. There's a plan to become a member of the European Union. And one of the elements of those plans are to fight corruption. So there is corruption in Ukraine. And they said, okay, we have to fight it. And whether there's a political will to fight it, you never know exactly whether that's right, but you have to fight it. Similarly, I read the results of the presidential elections in Colombia last Sunday, and there were two candidates on top of that. And both candidates, the elected president and the second one, they had fighting corruption at the top of their agenda. So you have to work on that. And if you work on that broader issue, we in road safety will profit from it. Because I fully understand that if you have enforcement not meant to change behavior of motorists, but to gain income for police officers, then you never trust a system like that. And then it's almost impossible to use enforcement for improving road safety. So unfortunately, a very broad issue, a very relevant issue, but you have to work on it. I gave you two examples of countries that are going to work on that. And I hope that more countries are going to work on that.
Thank you so much. We have almost reached our time limit for this webinar. I just want to ask a short question from Patrick. What is the role of NGOs, or how can NGOs could help improving the post-crash care? Because mostly we see that they are advocating for, I don't know, road safety behavior, or mostly they are active in this pillar, but how they can help with the post-crash care?
Okay, thank you very much for that question. Actually, maybe the road user behavior stands out like, the main thing that NGOs are doing, but that's not correct. We have NGOs taking from the previous decade of action and the 5 pillars. NGOs are involved from infrastructure, from vehicle standards, road user behavior, all the post-crash, the 5 pillars. Maybe road user behavior because it covers maybe a wider spectrum from the pedestrian, drivers, cyclists, all that, the user behavior. That's why it's quite maybe prominent. But we do have, for example, very, very serious members and organizations within our Global Alliance that are working on post-crash. So all the way dealing from Good Samaritan Law in India across to victim protection and injury, compensation. We have that. So if we do that, there's a lot of members doing post-crash. And a good example would be India, South America. We are having that very, very prominently being done there. So if you need more information, again, just reach out to us and we'll be able to link you up with post-crash, people who are doing post-crash in the communities.
Thank you so much. Thank you, everyone who joined and attended. And you wrote your comments, send me emails, and talked about that you liked these 2 webinars, and hope be able to continue webinars like these. We will send you an evaluation form. Please help us with filling it out. And I want to say special thanks to Fred for joining us. Thank you, Dan, for being with us in this webinar. Thank you, Patrick. Thank you, Mohsen. And again, I want to say a big thank you to my friend Hafez that helped us with co-organizing the event from Australia. I know maybe it's late there, and thank you so much for being with us. Thank you everyone who joined. Unfortunately, we have no time for more questions. So please ask your question or email me, and then I will ask the panelists to provide answer. I'll be back to you. Thank you so much and have a nice day. Bye-bye.